Parents will go to any lengths to make their child feel better when they're sick or in pain.
For a mom and dad in Tennessee, their efforts to get what they call a life-saving treatment for their adopted son became tangled in a web of red tape.
Can't block it.
Jamison Wall has had a difficult life.
He's been dealt a really difficult hand of cards.
He was born drug dependent, has autism, and a condition called pediatric autoimmune neuropsychiatric disorder associated with streptococcal infections, or PANDAS. The National Institutes of Health says children with PANDAS suddenly show extreme changes in personality, tics, abnormal movement, and rage. The changes start abruptly after an infection like strep. For a child like Jamison, the symptoms can be worse.
He can wake up one morning and it looks like he has Parkinson's. He would engage in self-harming behaviors and draw blood.
Sushi shape.
Sushi served as Jamison's service dog.
Come and get it.
The Walls adopted the pit bull mix from a local shelter in 2022. Sushi brings comfort to Jamison during some of his most trying times.
Goodbye, Sushi. On treetop.
But Sushi can only provide so much comfort to Jamison in his time of need.
His parents say Jamison requires a treatment for his PANDAS called intravenous immune globulin therapy, or IVIG, which medical experts say is controversial and can cost up to $25,000 out of pocket.
But Jamison was forced to stop his therapy when the Walls' employer switched insurance carriers, and the new company denied coverage for IVIG.
Reporter Amanda Hara examines the fight to get Jamison the treatment his parents say he desperately needs to live.
Spring symbolizes rebirth.
Stop.
But Laura Wall says what's happening inside of her home is more like a slow death. When you say he's dying, what do you mean?
He's certainly not living. He is falling apart.
Stop fighting. Honey, you're not being safe.
Laura says this video shows her 9-year-old spiral towards physical danger. She says Jamison's dramatic change came the moment he missed a treatment that had been helping his PANDAS called IVIG.
He was doing so much better when he was getting the IVIG treatments, and he had started to eat food by mouth. He had started to improve handwriting. He was able to work a light switch.
Laura and her husband both work for Metro Police. But when Blue Cross Blue Shield lost the bid for Metro government, leaving Cigna is the only option, Jamison lost access to those IVIG treatments.
If he needed a kidney, I'd give him both of mine. I would give him my life. I wish he didn't have to suffer. I wish I could take this for him.
Stop it.
In 2 recent denial letters, Cigna says IVIG is medically unnecessary. And a bill that would have required IVIG coverage from private insurers didn't appear to have enough support in the legislature. If this continues, what happens next?
Our only option is residential care. There's no way to keep him safe.
On top of spaghetti, all covered with cheese.
Laura says their 3rd and final appeal with Cigna was just denied. She's hoping her doctor has one last string he can pull. She sees it as the only way to restore her son to what he was. How important is this decision?
There's nothing else that matters. It's like denying a diabetic insulin. You can't live without it. Can you pet Blue? Because I think he's feeling a little neglected.
So even though Cigna denied coverage in 2 different levels of appeals, the Walls found out they could go to the Metro Benefits Board for a final appeal. In May 2024, that board voted to cover IVIG treatments for Jamison. The Walls say they wouldn't have been able to afford the cost themselves. They say Jamison is doing much better now, eating solid food instead of relying solely on a feeding tube. In Nashville, I'm Amanda Hara.
In Jamison's case, the decision to cover the IVIG treatment is what's called prior authorization, a process where insurance companies decide whether to cover a medical procedure or a prescription.
Insurance companies claim prior authorization saves money by eliminating waste in the healthcare system, but critics say it's often unclear how a decision to cover a medical procedure or prescription is made.
Go to investigatetv.com and type "permission to practice" in the search bar to read and watch our in-depth reporting.